Welcome back. With me is Neal Harris, stress management counselor at the Alexian Brothers Medical Center. Hi, Neal.
How you doing?
Welcome to the show.
Thank you very much.
Basically, I wanted you to give us an overview of what stress is, in case anybody out there doesn't know.
Okay, I'm sure a lot of people are very aware of what stress is. As I see it, stress is a combination of either pressure and or change. Whenever you run into a situation, Ismail, of being under a lot of pressure, or something new has happened in your life, or you're anticipating something exciting or something not so hot happening in your life, that creates stress.
Okay. And how does stress relate to diabetes and what you're dealing with?
Well, stress is a major component in diabetes self-management because stress affects blood sugar. And as we know, blood sugar is a very important component to keep in control when you have diabetes. Stress, in most cases, causes blood sugar to rise. Okay? So even if, for example, you're taking the right medications, you're exercising properly, you're eating right, even if all those components are working well and you're doing those well, if you're under a lot of stress, that can throw your blood sugar totally out of control.
So what we see here is that what you're working on really does have a scientific basis to deal with diabetes.
Very much so. In fact, a lot of the relaxation techniques that I teach began back in the 1960s at Harvard University, where a Dr. Herbert Benson was working to find out what really would create relaxation in human beings. He started out working with monkeys, and around that same time, there was the Transcendental Meditation movement. I don't know if you're familiar with that,
Yes.
but meditators would come by and ask Dr. Benson, oh, please test me. Let me show you the benefits, the physiological benefits of actually meditating. And he would say, no, 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 I'm working with my monkeys. I'm not interested. But after these meditators camped out on his doorstep for a long period of time, he finally gave in, and he said, oh, okay, let's do it. So he tested them, and he found that there were very significant physiological benefits to meditation. And rather than saying, well, everyone go out and use transcendental meditation, he decided rather, he said, I'm going to break down transcendental meditation into something very basic and something scientific. And that's what I teach, is the scientific.
Okay. When you decided to put together a video that you have, where I think we're going to see a minute of it, what drove you to put that video together? Did you see an empty gap there that you had to fill? Were you trying to come up with a new technique?
It's very true. I looked at, for example, not only people within the Diabetes Treatment Center, both outpatients and inpatients. I looked more at the idea of people laying in their beds hospital-wide, sitting in chairs, awaiting scary type procedures, being in physical pain or emotional pain. And I said to myself, there must be something that we can do for them. And that's kind of what spurred me on to create this videotape. Something where we can show this to people on the in-house station, and for at least 15 minutes, they can learn some valuable techniques that they can take with them after the hospitalization to help them relax, and hopefully to reduce some of their pain that they're in, emotional and physical.
Okay, I think we're going to go to a little bit of the video right at this time. And after the video, maybe you can tell us a little bit about one or two of the things that are on it.
Oh, I'd be happy to.
Okay?
Okay.
Great.
Now, discontinue using the word peace and replace it with the phrase, my hands are warm, relaxed, and warm. My hands are warm, relaxed, and warm. And continue to repeat this to yourself. And as you do, imagine lying on a beach on a sunny summer day with your hands immersed in the warm sand. As you continue to say to yourself, my hands are warm, relaxed, and warm. And feel your hands warming up.
Well, that's very interesting. I'm sure it's very effective.
It has been. I've used it both with patients, people in the community through various public talks that I've given at libraries and different professional organizations. And for the most part, people have found it very, very relaxing. In fact, some people have even said that they've fallen asleep during it. Now, for most videotapes, that's not a very good comment, but for mine, I really appreciate it.
Okay, so what's been your response in terms of positive and negative to the in terms of people?
What I've been doing a lot is get into people's rooms, and when they've been either under a great amount of stress or a lot of pain, I've found that it has been able to help them, and that's really gratifying.
Okay. Could you tell us a little bit about one or two of the different parts in the video?
Certainly.
I think you wanted to touch on
I'd be
that.
happy to, certainly. First of all, I teach people how to breathe properly. A lot of us don't breathe properly, especially when we're under stress. We tend to breathe in a very rapid and very shallow fashion. So by teaching a form of deep breathing can help get necessary oxygen into the system, and people can think and reason clearly as a result. So they can help themselves solve the various problems that come up, the little stresses in life that come up minute by minute, hour by hour, day by day. From there, I go into the relaxation response. And that's what Dr. Herbert Benson at Harvard had developed when he stripped transcendental meditation of all the hocus pocus in the Eastern tradition and philosophy. He created this. And all it is after you take a few of these deep breaths and start feeling more relaxed, what happens is on the exhale of your breath, you say to yourself a word that you find relaxing, like peace or love or God, some word or phrase that you find relaxing.
Okay.
Okay.
I think at this time we're going to show the phone number that they can contact the treatment center if they are interested. And I want to thank you very much for being on the show. It's been very interesting. I'm sure a lot of people out here will benefit, if not directly, somehow through the benefit of learning something that will help them relax. I'm sure we all need a little bit more relaxation in our lives. And we'll be right back.
It's easy to think one person can't make a difference.